Hi guys, so this is my fifth post about my thyroid cancer journey. Yesterday I had my pre-op appointment, the official pre-op appointment, because I have a surgery date. Just to give you an idea, I was diagnosed on April 5th, and today is June 30th, and my surgery is July 8th. So it's a couple of months that I've gone through the regular sonic ultrasounds, the fine needle aspiration biopsy. I've had different blood work done, that nose scoping that I talked about in my second post. So I'm a week away, exactly a week away from surgery. The pre-op appointment was a couple of hours long. I talked to nurses who asked about, took my different stats, like my weight, my height, my dietary preferences, stuff like that. And I met with the anesthesiologist, who was a nice man, and they gave me a bunch of information for my hospital stay, and so I'll share it with you. Well, I'll show you what I got. So the hospital gives out this guide to pain management after surgery, which teaches people about what pain is and how this hospital in particular helps patients to manage their pain post-surgery. The guide made me feel very confident that I will feel comfortable while I'm in hospital. I should also say that every surgeon is different, and mine happens to admit his patients into the hospital, and I'm supposed to plan post-surgery, and I'm supposed to plan for 3 nights there. It might be a bit less or it might be a bit more. The goal is to, or the purpose is to monitor my calcium in case the parathyroid glands stop working, or there are issues and my calcium isn't stable, which can happen with this type of surgery. The second one I got is planning for my inpatient surgery. And it shows me where to go and tells me about eating and drinking before surgery, what not to eat, what not to do, what to do, all that kind of stuff. The other thing I received is this patient information complex thyroidectomy booklet that I'm supposed to bring with me to the hospital. It's really helpful, actually. It lays out what they refer to as the care pathway of what I can expect immediately post-surgery to be done to me and what I can do to help my recovery, as well as the 2 or 3 days post-surgery, what I need to pay attention to and what will happen before I'm discharged from the hospital. And the fourth thing I received is welcome to the hospital admission information, and that's about if I want television or telephones and where people can park and what visiting hours are. All in all, I found these booklets really helpful. They made me feel kind of on top of it and more confident. Apart from that, I feel really anxious. I'm in a bit of disbelief that I'm here. I'm about to have the surgery. It feels like forever, even though it's not been very long. And I'm nervous, but I also feel good, and I feel very confident in the surgeon's abilities and in the hospital's ability to care for me, and I have a lot of support around me. I hope that you do too. And I suspect that my demeanor and whatever will be different after my surgery, but whatever, here we go. I'll think of something to post pre-surgery, and then we'll definitely share some new stuff post-surgery. Thanks for watching, and please share if you know anybody with thyroid cancer who might find this helpful, or comment. I'm happy to chat if you are going through this as well, either as yourself or as a care provider of someone who is going through thyroid cancer treatment as well. Okay, thanks.